A 68-year-old man woke up feeling perfectly well, but shortly after a routine medical appointment, his wife was forced to dial 911. He went in for a standard screening, doing exactly what the medical guidelines instructed him to do. What followed was a devastating cascade of false alarms, invasive biopsies, and a heavy dose of unnecessary medication that left him suffering from severe brain fog, chronic pain, and extreme fatigue. I see this tragedy unfold constantly. You are told that routine screenings are the ultimate shield against disease. But for men and women over 60, the biological reality is drastically different. The very test designed to protect you can suddenly become the fastest route to losing your independence, landing you in a hospital bed or a nursing home. You are completely justified in feeling a growing distrust toward the traditional healthcare system that pushes these procedures during hurried, 10-minute appointments where doctors merely prescribe more interventions. I've spent my entire career inside that system. I have seen firsthand how the relentless push for profit over health leaves you feeling completely powerless and ignored. Today, we are breaking that cycle. I'm going to expose 5 routine medical screenings that shift from being helpful to highly toxic after you turn 60. We will explore how these specific tests trigger a dangerous domino effect of overdiagnosis, leading to aggressive treatments that destroy your body. You want to prioritize living your life with dignity and autonomy, rather than suffering through unnecessary medical interventions in a hospital bed. By the end of our time today, you will have the exact knowledge you need to advocate for yourself, question these outdated protocols, and take back control of your health. The first screening on our list is one you probably have scheduled on your calendar right now, and the hidden truth about its risks will change how you view your annual checkup forever. I am Dr. Marcus Caldwell. I am an active cardiothoracic surgeon, and for decades, I have stood on the absolute front lines of medicine. I have spent countless hours opening chests and physically holding beating human hearts in the palms of my hands. I know the incredible power of modern medical procedures, but I also know the unspoken flaws within the industry. I am speaking to you today because I am utterly exhausted by a system that reduces your entire life to a frantic 7-minute consultation. I am tired of seeing vibrant men and women treated merely as numbers, rushed out the door with another prescription or test. You deserve more than a robotic dismissal. You deserve a doctor who tells you the unfiltered truth about what happens to your biology as you age, explaining the actual root causes of your symptoms. The medical establishment has a massive blind spot regarding seniors, and what I am about to reveal regarding the hidden enemy inside our standard guidelines will completely shatter everything you thought you knew about staying healthy. For decades, the medical establishment has operated under a massive, unquestioned assumption. The more we test, the safer you are. We are trained to hunt down every single anomaly, every slight elevation in a blood panel, and every microscopic shadow on an X-ray. But here is the critical failure in that logic. The medical guidelines that dictate these routine screenings were not written for the biology of a 65 or 75-year-old body. They were built around the physiology of middle-aged adults and then clumsily applied to everyone else across the board. The real enemy here is not a malicious conspiracy of doctors wanting to cause harm. The enemy is a deeply entrenched system of outdated, rigid guidelines that refuse to acknowledge how human biology fundamentally changes as we age. When you step into that clinic, your doctor is racing against a ticking clock. They are given 7 minutes to review your chart, make a decision, and move on to the next room. In that rushed environment, it is incredibly easy to simply order the standard battery of tests. It requires zero critical thinking to tick the boxes for aggressive screenings, extensive cardiovascular stress tests, or routine scopes that the hospital algorithm demands. But what these outdated guidelines completely fail to account for is the devastating phenomenon of overdiagnosis. As our bodies mature, we naturally develop harmless, slow-growing cellular changes. Many of us have tiny abnormalities that will never, ever threaten our lives. You could live to be 95 and never know they were there. But when a highly sensitive, routine screening catches one of these harmless shadows, The rigid medical protocol demands immediate action. Suddenly, you are thrown onto a terrifying conveyor belt of invasive biopsies, harsh medications, and high-risk surgeries. You are treated for a disease that was never going to hurt you. But the treatment itself, the anesthesia, the surgical trauma, the toxic pharmaceuticals, can permanently destroy your independence and your cognitive health. I need you to hear this loud and clear. If you have ever felt rushed into a procedure you were unsure about, or if you are currently suffering from the crushing fatigue and physical decline following a medical intervention you did not truly need, it is not your fault. You did absolutely everything right. You respected the authority of the white coat. You showed up for your appointments. You followed the instructions handed to you, believing you were taking proactive steps to protect your future. You were being a responsible patient. It is the system that failed you. The system prioritized a generic, one-size-fits-all checklist over your individual quality of life. The system valued generating a billable procedure over taking the time to explain the profound risks of overtesting an aging body. You have been carrying the burden of anxiety, wondering if your body is failing you, when in reality, your body has been fighting to heal while being subjected to a barrage of unnecessary medical trauma. We're going to lift that burden of guilt off your shoulders today. It is time to stop being a passive passenger on the medical conveyor belt and start becoming the ultimate advocate for your own longevity. You need to understand exactly what happens inside your tissues and organs when these specific tests are performed, because the mechanical truth of these procedures is shocking. What actually occurs inside your body when you agree to these screenings is something the 7-minute consultation will never reveal to you. To truly grasp why these standard procedures can become so destructive, we must look closely at the profound biological shifts that happen inside your body after your 60th birthday. Your cellular environment fundamentally changes. When you're 30 or 40, your body possesses a massive biological reserve. Your tissues are highly elastic. Your immune system is aggressive but heavily regulated, and your organs can easily absorb the shock of chemical dyes, invasive probes, and the physical trauma of biopsies. But as you pass 60, that biological reserve naturally and beautifully adapts. Your body stops prioritizing rapid cellular turnover and instead focuses on conservation and stability. Your internal tissues become more delicate. The mucosal linings of your digestive tract thin out. Your kidneys, which filter toxins from your blood, naturally lose a fraction of their aggressive filtration capacity. This is not a disease. This is the normal, elegant maturation of the human machine. But standard medical screenings do not respect this delicate maturation. They treat your 70-year-old biology with the exact same blunt force they use on a 30-year-old. Let us look at what happens viscerally when you undergo an aggressive, unnecessary screening. Consider the routine use of heavy, iodine-based contrast dyes injected into your veins for standard CT scans. For a younger person, the kidneys flush this thick chemical out in hours. For a senior, pumping a liter of this dense contrast dye into the bloodstream forces the aging kidneys into sudden, violent overdrive. The tiny, fragile filtration units inside your kidneys can become choked. This causes a sudden spike in blood pressure and can trigger acute renal injury, leaving you with chronic fatigue and a toxic buildup in your blood that your doctor might suddenly misdiagnose as a brand new disease. Or consider the physical trauma of routine, deeply invasive scopes, and the biopsies that inevitably follow. When an instrument scrapes against the thin mucosal lining of your colon or your stomach, or when a hollow needle punches through your prostate or breast tissue to capture a sample of a perfectly harmless, slow-growing cellular change, it acts as a biological earthquake. Your immune system perceives this puncture not as a helpful test, but as a severe, life-threatening injury. It rushes massive amounts of inflammatory proteins to the site. Because your older body has less biological reserve, fighting this medically induced trauma drains the energy away from your brain and your heart. This is exactly why so many seniors experience crushing brain fog, severe memory lapses, and total physical exhaustion for weeks or months after a supposedly simple outpatient test. The screening itself created a massive inflammatory storm. To understand the tragedy of overdiagnosis, consider a beautifully crafted, antique woven tapestry. Over 70 years, this tapestry naturally develops a few loose threads, tiny faded spots, and microscopic frays. These are simply the marks of time. The tapestry is still magnificent, structurally sound, and capable of hanging beautifully for decades more. But standard medical screening is like a technician coming in with a high-powered magnifying glass, finding a single microscopic loose thread and deciding it is a fatal flaw. To fix it, they scrub the delicate antique fabric with harsh chemical solvents and a heavy wire brush. They do not fix the thread. They tear a massive, irreparable hole right in the center of the masterpiece, destroying its structural integrity forever. Your organs are that antique tapestry. You have tiny, microscopic cellular clusters that are completely dormant. We call them incidentallomas. They are walled off by your immune system and will never grow fast enough to threaten your life. But when a highly sensitive screening finds that loose thread, the medical protocol demands the wire brush. They order the biopsy, the radiation, the harsh medications. They destroy your quality of life to cure a shadow that was never going to hurt you. Do not just take my word for it. The scientific literature is finally catching up to this tragic reality. A landmark, comprehensive analysis published in the Journal of the American Medical Association tracked tens of thousands of older adults who were subjected to aggressive routine screenings for slow-growing, age-related cellular changes. The data was absolutely chilling. The researchers discovered that the patients who underwent relentless routine testing suffered drastically higher rates of sudden hospitalizations, severe psychological trauma, and rapid physical decline directly caused by the follow-up biopsies and treatments. And the most shocking part? Their overall mortality rate did not improve. They did not live a single day longer than the seniors who completely skipped those aggressive tests. They simply traded their mobility, their mental clarity, and their peaceful retirement for a false sense of security and a cabinet full of new prescriptions. The trauma of the test far outweighed the theoretical benefit. We are treating the scan rather than treating the patient. But now that you understand the mechanics of how these procedures physically assault your biological reserves, we need to get very specific. We must name names. There are 5 exact routine screenings that you need to critically evaluate right now. The very first one on this list is pushed on almost every senior annually, and discovering the simple, zero-risk alternative will instantly put the ultimate control of your health back into your own hands. The very first routine screening that becomes incredibly hazardous after you cross the threshold of 65 or 70 is the asymptomatic colonoscopy. We have been conditioned to believe this is the ultimate gold standard of preventive care. But let us look at the biological reality of this procedure for an aging body. The danger does not just begin when you're sedated in the clinic. It starts the night before in your own bathroom. The required preparation involves drinking massive volumes of harsh, chemical laxatives to forcefully purge your system. For a younger person, this is deeply uncomfortable. For a senior, this violent purging causes rapid, severe dehydration and a massive depletion of vital electrolytes like potassium and magnesium. I have seen healthy older adults arrive at the hospital with acute kidney injury or severe heart palpitations simply from the physical shock of the preparation process. Once on the table, introducing a rigid scope into an older, thinned colon carries a terrifyingly real risk of perforation. So, what is your highly effective, zero-risk alternative? Step 1 is to ask your doctor for a non-invasive stool test, such as a FIT test or a DNA-based stool test. These modern marvels are completed in the complete privacy of your own home, with zero fasting, zero harsh chemicals, and zero risk of tearing your delicate internal tissues. They are incredibly accurate at detecting the very early, microscopic markers of a problem without subjecting your body to a violent physiological earthquake. Write this down and ask your doctor at your next appointment. Since I have no symptoms, can we start with a non-invasive FIT test this year? The second screening trap involves aggressive, hypersensitive cancer screenings for slow-growing anomalies, specifically the blanket PSA blood test for older men and routine mammograms for women over 75 who have absolutely zero family history or symptoms. Remember the antique tapestry we talked about? These tests are the magnifying glass hunting for a loose thread. The overwhelming majority of cellular changes found at this age are incredibly slow-growing. They are indolent, but when a hypersensitive screening flags a microscopic shadow, the rigid medical protocol kicks in, demanding deeply invasive needle biopsies. These biopsies trigger severe bleeding, dangerous infections, and massive psychological terror. The treatment that follows, radiation, aggressive surgery, or hormone blockers, utterly destroys your continence, your mobility, and your cognitive clarity. Step 2 is mastering the power of the pause and monitor protocol. If a screening reveals a tiny, asymptomatic anomaly, you do not have to rush to the operating table the next morning. You have the power to step back. Ask your physician this exact phrase. Given my age and the slow-growing nature of this finding, can we adopt a watchful waiting approach and simply recheck it with a non-invasive ultrasound in 6 months? You are not ignoring your health. You are strategically protecting your biological reserve from unnecessary surgical trauma. Our third toxic screening is the routine cardiac stress test using radioactive imaging dyes for patients who have absolutely no chest pain, no shortness of breath, and no symptoms of heart disease. As a cardiothoracic surgeon, this one infuriates me. Doctors often order this simply as a baseline check. But pushing an aging, asymptomatic heart to its absolute maximum capacity on a treadmill, or worse, injecting heavy pharmacological chemicals to artificially simulate a heart attack, is sheer madness. It places immense, completely unnecessary strain on your cardiovascular system. The radioactive dyes used in these imaging tests aggressively tax your aging kidneys to filter them out. Step 3 is demanding functional, blood-based markers instead of physical trauma. Instead of a traumatic stress test, ask your doctor to run an advanced lipid panel and, most importantly, a high-sensitivity C-reactive protein test, known as HSCRP. This simple, safe blood draw measures the exact level of hidden inflammation inside your arteries. It tells us everything we need to know about your cardiovascular risk without forcing your heart into a state of absolute panic. The fourth toxic screening is the routine thyroid ultrasound. Doctors frequently run a wand over your neck during a checkup just to be thorough. Here is the biological truth. Almost every single human being over the age of 60 has tiny, completely harmless cysts or nodules on their thyroid gland. They are a normal part of aging, just like wrinkles on your skin. But the moment the ultrasound detects these harmless bumps, it triggers a cascade of anxiety and painful needle biopsies right into your neck. Often, to be safe, parts of the thyroid are surgically removed, condemning you to a lifetime of highly sensitive synthetic hormone replacement pills that constantly cause fatigue, weight gain, and brain fog. Step 4 is protecting your hormonal engine. If your doctor suggests a routine neck ultrasound, politely decline and ask them to simply test your TSH blood levels. If your blood work shows your thyroid is functioning beautifully and you have no trouble swallowing, there is absolutely no reason to go hunting for harmless shadows with an ultrasound. Leave your delicate thyroid alone to do its vital job. The fifth and final toxic screening is not a single machine, but the relentless, aggressive testing of your hemoglobin A1C and blood pressure to force your numbers into the ranges of a 25-year-old. The guidelines blindly demand that everyone, regardless of age, hit a blood pressure of 120/80. To force a 75-year-old body into that rigid box, doctors prescribe 3, 4, or sometimes 5 different powerful medications. This toxic cocktail of beta blockers and diuretics plummets your blood pressure so low that blood cannot reach your brain. You stand up, the room spins, and you suffer a devastating fall, breaking a hip and ending up in a nursing home. Step 5 is shifting your focus from rigid numbers to functional vitality. The science is incredibly clear on this. Older adults naturally require a slightly higher blood pressure to push oxygenated blood up into their brains. A systolic pressure of 130 or 140 is often protective, preventing dementia and severe brain fog. Instead of accepting another pill to artificially crush your numbers, take control of your vascular health naturally. Spend just 60 seconds every morning doing slow, deep diaphragmatic breathing, inhaling for 4 seconds, holding for 4, and exhaling for 6. This simple, free habit naturally dilates your blood vessels, supporting your biology without a single side effect. The science behind why stepping away from these aggressive screenings works is profoundly simple. Your body possesses an incredible natural intelligence. When you stop attacking it with chemical dyes, unnecessary physical biopsies, and toxic medications meant to fix harmless shadows, you immediately halt the chronic inflammatory cascade. You allow your immune system to stop fighting the medical interventions and start focusing on genuine cellular repair. You preserve your energy, your mental sharpness, and your physical independence. You do not need to be at the mercy of a 7-minute appointment. You now hold the exact blueprint to protect your body. Use these questions. Have a better, more empowered conversation with your doctor. You have the ultimate authority over what happens to your remarkable, resilient body. Please listen to me carefully. The information we discuss today is meant to empower you, not to replace your personal physician. This is general medical information. Your body and your medical history are incredibly unique. Do not use this video as an excuse to suddenly cancel a scheduled procedure or throw away your current prescriptions. Instead, I want you to use this knowledge as a powerful tool. Please talk to your doctor before stopping any medication. Take the exact questions we covered today, bring them into your next appointment, and use this video to have a much better conversation with him or her. Advocate for yourself, but always make those final decisions together with a trusted medical professional. I need to hear from you. Have you ever felt pressured into a routine procedure or a sudden surgery that ended up leaving you feeling worse? Or maybe you're currently dealing with the painful aftermath of a medication you never really needed. Drop a comment below right now and share your experience. Your story matters. It validates exactly what we are fighting for on this channel. And reading your words might just give another senior the courage to speak up and question their doctor in that intimidating, sterile office. Please, do not keep this vital information to yourself. The traditional medical establishment is not going to hand this knowledge out in the waiting room. I am practically begging you to share this video today. Send it to your spouse, a sibling, or a dear friend over 60 who deserves to hear the unvarnished truth. It could literally save them from a devastating, completely unnecessary medical intervention that robs them of their golden years. You now know exactly how to protect your biological reserve from toxic screenings. But there's a silent, everyday threat lurking in your kitchen right now that is actively stiffening your arteries. You probably think you are eating a heart-healthy breakfast, but it is actually causing microscopic damage to your vascular system every single morning. I expose exactly what this food is and the simple morning habit that heals the damage in the video you see on your screen right now. Click on that video, and let us continue this journey to reclaim your absolute vitality and independence. I will see you over there.